Hi, I'm Bob Iaculo. United Water believes that all citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus, New Jersey has been provided by Berkeley College, New Jersey's credit unions, banking you can trust, United Water, making the planet sustainable is the best job on earth, MD Advantage Insurance Company of New Jersey, Adler Aphasia Center, Celgene Corporation, committed to improving the lives of patients worldwide, and by Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Promotional support provided by the Star Ledger, powering NJ.com, and by NJ Biz, all business, all New Jersey.
Hi, I'm Steve Adubato. It is my honor and my pleasure to introduce the president of the New Jersey Education Association, 200,000 members strong. Is that correct?
Yes, very good.
Now, for folks who do not know, Wendell, what the NJEA is, describe it.
The NJEA represents 200,000 public school employees and retired members. Of that, there's probably about 123,000 teachers in that, 50,000 support professionals. And we basically do three things. We make sure we protect our members' rights, we try to improve our members' rights, and we try to improve public education as a whole for children across the state of New Jersey.
You got into teaching when and why?
Back in, well, I graduated from college in 1978, so actually my first job was in New Jersey. Graduated in Pennsylvania, so there's a little cross there. My mother was a teacher, my older sister was a teacher, you know the deal.
There's history. There's history in the teaching profession, correct, in your family?
Right.
And it's interesting, as you get into teaching, where does the piece of the New Jersey Education Association come in for you and you say, hey, there's this organization that represents us, I want to be a part of it?
Came in, actually the first day I looked at...
The first day you started teaching.
Yeah, they had just negotiated a contract, and I looked at the contract, and there was 16 steps on a guide. That was great, and I was on step 1, because that's where you start. And I looked at
the salary guide.
And the salary guide, okay. Right. And then the next year I looked, oh, I'll be on step 2, but there were now 17 steps. And then the next year I was on step 3, and there was 18 steps. I go, something's not quite right here. So, couple years, I got involved with negotiations, and then just, you know,
the rest is history.
Right in there. So I guess looked at the contract.
Yeah, well, being the president of the NJEA puts you in the middle of all kinds of interesting situations. And people have their view of the organization based on what they know, they don't know, they think, they have opinions. What would you say in terms of the brand or the reputation of the NJEA for those who are critical? You would argue the biggest misconception is?
We do contracts and grievances. I think that's what they do. We do negotiate and do grievances. And I will admit that is our bread and butter. That's that part where I was telling you about protecting members' rights and trying to improve them. What they don't see is the professional development. We have a whole division that we devote to professional development to improve the teachers. We have the communications. We do our research. You know, when we say something on TV or in print, it's accurate. You know, there's no truth-o-meter to put to that. It's there. So they also don't see the community work that we do, the partnerships that we have with organizations. That's probably the part that people don't know about.
Well, it's interesting because, again, I don't even have to say, I'll say full disclosure for those who don't realize it. The NJA is a significant supporter of public broadcasting in the state, of the nightly news, NJTV News, and also of our programming as well. And the other piece of it, Classroom Close-Up, talk about partnerships,
yeah,
which celebrated a big anniversary, right?
Right, 20th year.
20th year.
Yeah.
Describe what Classroom Close-Up is and why that is part of the partnerships and the education and the celebrating of educators that you talk about.
Well, Classroom Close-Up is dedicated, if you're talking about positive perspective on things, that's all Classroom Close-Up.
It's a television series on NJTV right now, celebrating teachers.
Goes into schools, looks at innovative projects, teachers, what they're doing, and very successful, by the way. They've, I think, yes, 11
Many Emmy
Emmys.
Awards, right?
11, yes, from New York and Mid-Atlantic.
What does it do for educators and those connected to the series when they are featured?
Well, the funny thing about it is we're about to launch, breaking news here, an NJEA app, but we have cataloged all of those classroom close-ups that you can go into our website, put in a category, use it in the classroom, get ideas from it for all of our members. So that's the important part, I think. It's not just, well, we did a show and that's it. It's cataloged, it's indexed to help our teachers throughout the curriculum.
As president of the NJEA, some of the things that you are doing and that you want to do, this is one example you just described, in terms of moving the organization to the next level.
Well, first of all, we have a brand new leadership team. I mean, completely. I just became president. We have Marie Bliston, vice president, Sean Spiller, secretary treasurer. We also have a new executive director, Ed Richardson, and assistant executive director, Steve Swetsky. All 5 positions are brand new, starting in September.
What is that an opportunity to do?
I see a new synergy going through. My philosophy is bring your problems, but bring a solution with it so we can work towards something. It's not just a place to complain, it's a place to solve things. And I think that has caught on. I can see just in the last few months how we're moving forward and we're being more decisive in taking action. So,
and along those lines, when we talk about teacher evaluation, the teacher evaluation process, and as we do this program in the spring of 2014, we're into the 2nd year, correct?
Right.
Okay.
Teacher evaluation. Mm-hmm.
You say not just criticize, but also offer recommendations for solutions. You've been critical of the teacher evaluation process, fair to say?
Fair to say,
What's
yes.
wrong with it, and what would be a better solution in that spirit?
What's wrong with it is they did it completely backwards. They should have done, there's 3 topics linked to it. There's Common Core, there's the PARC assessment, and then there's evaluation. The Common Core they introduced back in 2010, which are standards. And we believe in standards. We support standards. We support the Common Core age-appropriate wise. But they did nothing to put the curriculum around it and to have teachers unpack them and work with them and create materials. No textbook company out there has any core curriculum activities. They're nothing. They say they do. They slap it on the thing, but they don't because it hasn't been developed. And the reason they didn't develop it because they were teaching to the other assessment, which was the ASK and the HESPA. So
these are all standardized tests.
Standardized tests.
What's wrong with doing that, Wendell?
There's nothing wrong with doing it, but now they're changing the test, and the core curriculum went to it. So it's a bait and switch kind of thing in the middle. Well, why would I work on changing my curriculum when it doesn't align to the test that's coming? I'm going to keep working on the stuff that aligns to the test. So next spring, they're going to give, in the spring of 2015, they're going to give this PARC assessment.
What does that mean? What does that stand for?
PARC, Performance Assessment. It's an acronym.
Another acronym in government. Amazing. It's some sort of assessment.
But it's an assessment. It's actually going to be twice as long as what's being done here. It's going to be on a computer, which nobody has enough computers to do. It's going to require bandwidth. And it's going to be in a 20-hour or 20-day testing period. So it's basically assessment on steroids. What they're doing is they're turning our schools into testing factories. And now, that's a long background to get to your question on evaluation. The evaluation is going to tie into that that assessment, which has not been given, which is, and every time they change an assessment, there's a new baseline. They say, oh, we're going to do a new baseline, which means it's gone down because they make it higher
Let me ask you
standards.
this. What impact do you think it's having on teachers and teacher morale?
It is the perfect storm to create a nightmare. They have 3 huge things coming out. They have Common Core. It's dropping morale. It's making it's making schools a place that you dread coming to. It's taking the joy out of teaching. It's taking the joy out of it for students.
And if someone were to argue, devil's advocate, hey, wait a minute, but we need to evaluate teachers, just like every other profession, you'd say?
We've been doing it for 100 years. But now we need a stronger one. The new evaluation models have 40 to 70 indicators in them. And you're going to come in and look at my classroom. You're going to come watch my classroom for 40 minutes. If there was only 40 indicators, you'd be checking them off one at a time.
Is it impacting student-teacher relationship?
I think, well, because it's driving it to the assessment, yes. Because,
Teaching to the test?
Yeah.
You worry about that?
I do.
As an educator, you worry about that?
Because at some point, there has to be a time where you can enjoy learning and make it fun. The fun, to be honest with you, it's driving the fun out of education.
Well, in the spirit of solutions, we'll, I assure you, on our sister program, New Jersey Capital Report, we'll continue our discussion on that, and we'll continue talking about it. But Wendell, I appreciate you joining us. 200,000 members strong for the New Jersey Education Association. We appreciate you being with us and wish you nothing but the best in your tenure as president.
Thank you,
Thanks,
Steve.
Wendell.
Appreciate it.
We'll be right back, right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Hi, I'm Steve Adubato. We're here with Rich Miller, who is the president and CEO of Virtua. We're talking about community health needs. It's interesting, this concept of community health needs. There's an assessment that has been taking place in how many counties down in South Jersey?
It's 3 counties, Steve. It's Camden, Burlington, and Gloucester County.
You didn't do it alone. You've done it with other healthcare institutions, hospitals around you. Who are they, and why is this so important?
Well, we actually started with the Burlington County Health Department, Virtua and the Burlington County Health Department. Then we reached out to the other health departments in Camden County and Gloucester County, and then to the hospitals, Cooper Health System, Kennedy Health System, and Lourdes Health System in southern New Jersey. And basically to show that we're all engaged in finding out what the community needs are.
But why? Here's the thing I'm thinking about. First of all, you're in competition with these other hospitals in some ways. I'm
Yes.
thinking, why do you get together with them in the first place, number one? And what do you wind up finding out about the needs of the community when it comes to health?
Well, what we found out, Steve, was the needs, they weren't shocking in any way. I mean, what we found out was a high incidence of chronic disease, things like obesity, hypertension, access to health care, understanding where health care is. So all these chronic disease conditions we all deal with. All the health systems deal with it.
Right.
And frankly, we're going to have to partner to get underneath of this.
What do you mean partner?
What that means is we're all going to have to work on this and integrate together to get under the chronic disease issue, because no one can do it alone. It's impossible to cover that ground alone. And we don't want to duplicate it either. So the key is, how do we work together for the betterment of patient health and wellness in our community?
So let's take it back a segment. So say you're dealing with diabetes. Did that come up at all?
Diabetes was one of the major health conditions.
So you got diabetes.
Right.
Is obesity in there?
Yeah, because diabetes stems from obesity, type 2 diabetes.
What else did we find? Was it heart?
It was hypertension.
Okay.
We found cancer care was an issue in the community from their perspective. And asthma was another issue in the community as well. And different communities had different needs, Steve.
So here's the thing, because I know Virtua well, because we've done a lot of things together, I also know that competition is real too. So let me ask you a practical question. If Virtua has a really strong program in a certain area, a service line, a clinical area where you think you have the best people and you're taking care of folks in that area, and a competing hospital, they say they have the best, right? And you're putting out advertising and promoting what you have, and they're doing the same thing, respectfully, then where the heck is the place for collaboration when you're trying to bring people into your institution?
I think in time, Steve, I think we're going to have to make sure that we're collaborating. We're going to have to give up some things.
Give up?
Meaning that we're going to have to look to other health providers that provide service in a certain area that maybe is not our strength. So I'm going to look to other healthcare providers to say, this is your space, this may be our space, so that we don't duplicate those services, because there's a cost to duplication of services.
You're making it sound like the entire healthcare landscape, the model, the paradigm, if I can use that academic word, is changing to the point where everyone can't have their own.
No, it can't. I mean, I think that, in my opinion, Steve, the healthcare model is going to flip 180 degrees. And what I mean by that is, we're really going to change the way we provide care to the community. It's not build it and they will come anymore. It's we're going to have to reach out to the community and look at their health model and their wellness model and own it and really take it over from the primary care physician space to a care coordinator and start caring for people and reaching out to people at home to make sure their chronic disease is under control. Because if we don't do that, we see them 10 years later in our emergency rooms.
More expensive?
Much more expensive venue. So I'd rather see them, I'd rather put the money in healthcare on the front end, what I call the front end model, which is pre-hospital care, and really take care of people, put a game plan together for them. So when they go in and see their primary care physician, he should be their coach. He should be a coach in a way that puts a roadmap out for a community member and says, if you have diabetes or hypertension in your history, here's what you need to do, and we're going to monitor that, and we're going to stay in touch with you to make sure you stay well.
So this whole community health needs assessment that Virtua is involved in with other healthcare institutions in your area, you have to have primary care physicians intimately involved.
Right.
After the fact, once you get this information as to what the needs are, or it doesn't work.
Right. I mean, we could have predicted the needs, Steve, I'll tell you
You weren't
that.
shocked.
We weren't shocked by the findings. So, you know, we kind of knew it was out there, but now what do we do about it? I mean, how do we go to the community and say, we have to educate you and stay in touch with you to make sure that we keep you on a wellness path, not on a sick care path, because that's what healthcare, hospital care has been, and healthcare has been in this state for a long time. It's got to change. It's got to change that we're proactive about your health.
And final question, how much of what you're talking about, and you've described in this conversation, is directly tied to the ACA, or otherwise known as Obamacare?
I don't think a lot of it, I think it's, part of it is getting people covered. I mean, that's what the ACA's goal was. And I think there's an importance to getting the underserved population into Medicaid. I think it's highly important so we can connect to that population and take care of them that are underserved. But I also think hospitals and healthcare organizations were changing the delivery model well prior to the ACA. So we were on this path. We've been on this path for 10 years.
Going to do it anyway.
We're doing it anyway. Have to change the delivery model anyway, irregardless of the model of ACA, the coverage of patients. We knew that we'd have to change the delivery model. And that's up to us as providers of care to change the delivery model.
Status quo, not acceptable.
Not acceptable. Not at all.
Rich Miller from Virtua, thank you.
Thanks, Steve.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
We're pleased to welcome Aida Rivera, healthcare organizer with New Jersey Citizen Action. Good to see you, Aida.
I see you too, Steve.
We are doing this program in the spring of 2014 after the official enrollment period for the ACA.
Yes.
The Affordable Care Act has ended. Question, biggest lessons you say we take away from this enrollment period, particularly as it relates to the Hispanic Latino community?
The biggest lessons are the Latino community definitely want the coverage. They are eager and needed, absolutely. And that is the reason why New Jersey Citizen Action was so focused on working within these communities, because it's desperately needed. So once they were able to get all of their questions answered, and we were able to educate them and provide the awareness, they were quick to enroll and bring their friends and families and everyone that they knew that were eligible to enroll as well.
Well, okay, but go back.
Okay.
The issues with the website were not particularly an issue in the Latino community?
It was, Steve. You know that it wasn't working for a long time. They got the English version working before the Latino,
That's
the
what I was going to
Hispanic
say.
one.
What's up with that?
Yeah, that was a big issue. And, you know, we were, you know, fighting with people about that. But eventually, you know, luckily, they got it resolved. You know, so although it was late, but it was resolved, and once it was running, it was up and running, it was perfect.
Well, here's the
People were
thing
able to get
now,
on.
moving forward, as we prepare for the next enrollment period, which described for folks is, well, we should also say this. During the period we are in, from the spring of 2014 until November of 2014, which is for the next period, tell folks that there are certain areas, certain exemptions, or whatever you want to call them, situations, if you find yourself in, hey, you can enroll.
Right, well, it's the special enrollment period. So it's for people that have lost a job, that have an additional family member.
If you get married, yes?
If you got married, yes.
Okay.
If you had a baby, adopted a child,
Okay.
your wages have changed. Things like that. You've moved, changed location. That would qualify you under the special enrollment period.
The other thing that's fascinating is for people who are undocumented citizens.
Yes.
Be clear, because there's a lot of confusion on the part of some out
There is
there.
a lot of confusion.
Who was and is eligible, who is not?
Okay.
Does you have to be in the States for 5 years? Is that what it is?
Absolutely. And you have to have some sort of documentation. You have to have a green card or an asylum or something that allows you to enroll. If you are undocumented, basically meaning you have no papers at all, unfortunately, you will not be able to purchase in the marketplace.
Okay, you could not purchase in the marketplace, but you're still eligible for charity care in the emergency room.
Yes. So that would be the only thing that are people that are undocumented, that don't have any type of documents. They're basically considered aliens, you know, illegal aliens.
Got it.
They're the ones that will qualify for New Jersey Family Care.
As we get ready for the next go-around of this, your sense in the Latino community, less suspicious, okay? Because you do have a lot of folks, when we were doing a lot of the seminars with the support of the Healthcare Foundation of New Jersey, right? Our good friends who care very much about this.
Right.
One of the things we found in some of the workshops and seminars we did was that there's a significant amount of distrust, not just in the Hispanic community, but in other communities as well.
Absolutely.
About, you asking me these questions, federal government, who gets this information?
Right.
What am I susceptible to? Less so now that there's a first run?
I think it's less, but we still have to work out there. There is still a lot of people that are not comfortable with giving this information, especially with the people that are documented. They're afraid. You know, they don't want people knowing so much information about them. Maybe it's a mixed family. We have a lot of that. That's where the biggest
that mean?
suspicion. Mixed family means are people that are documented to live here, may have a parent that is undocumented.
Oh, that mix.
Yes.
I don't want to share that information because then you get to find out about my world, my family, and
Right.
potentially put one of my family members at risk.
Absolutely. And there are a lot of those. And I want to say that that's probably the category of people that are less than likely to share that information.
You have a post-enrollment conference coming up. Talk
Yes.
about that.
Well, we are eager to provide this post-enrollment conference. It's called Road to Coverage.
Road to coverage.
Yes, it's going to be taking place May 15th with the generosity of the space provided by Princeton University, with all of our sponsors and people that we've collaborated with, organizations throughout the state legislators, various people that we're going to have there talking about what worked, what didn't work, and what needs improvement for the next enrollment period. Unfortunately, it's not open to the public, so consumers cannot attend. It's more so for navigators, for certified application counselors, policymakers, social workers, health workers, those people.
If you were to say that for this next go-around of enrollment in the marketplace, one of the biggest changes that has to be made that will improve the situation, even though 7.5 plus million Americans signed up, we can argue more or less, how many in New Jersey, we could have done better, whatever. One change that would improve the situation next time around is?
I think the change...
Other than the website working for everyone more effectively across the board, go ahead.
Definitely outreach and awareness. I know that it sounds like it's been an ongoing discussion, don't people know already? There's still a lot of people that know about the marketplace, but are still not clear on what it is.
They hear it, they know about it, but what is it? How do I access it?
They don't fully understand. I'll give you a perfect example.
Sure, a few seconds left. Go ahead.
I spoke to a woman, self-employed. She thought that she would be charged to sit with a certified application counselor to have her complete her application.
But that's not outrageous to think, because it's a great service.
Right.
But that's not true.
It's not true. It's free. We have CACs and navigators throughout the state of New Jersey, free, that will help you enroll. So that's just a small example of the unawareness that's out there, the lack of awareness.
And finally, the role Citizen Action is playing in all this is?
We are out there. That is part of our job. We're doing advocacy work. We're making sure that people know. We're working with 9, grassroots community-based organizations in 9 separate counties, particularly for the underserved and the Latino community. And we are out there now doing outreach, education, enrollment.
You love this work?
I love this work.
Because?
I've been doing it for over 15 years.
No, but I mean, on this particular situation, why is this so rewarding, given how challenging it is?
Because it's for my people. I'm Latin. I understand where they come from. I know what the boundaries are. I know what the needs are. I can identify with them.
Okay, listen, I want to thank you, Aida Rivera, for everything you are doing, because there is nothing more important than getting people the insurance coverage they need.
Absolutely.
Thank you so much, Aida.
Thank you. Thank you so much.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Berkeley College, New Jersey's credit unions, United Water, MD Advantage Insurance Company of New Jersey, Adler Aphasia Center, Celgene Corporation, and by Cohn Resnick. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
I'm Paul Susek, Berkeley College class of 2002, Senior Marketing Manager, ESPN.
Carla McDonald, class of 2012, Senior Client Associate, UBS Financial.
Veronica Mormando, class of 95, Chief Operating Officer, PS Finance.
Tama Iguelas, class of 2006, Director, The Voice of Liberia.
From different walks of life, many of our students succeed in different ways, yet their first step is exactly the same: Berkeley College.